Hi, and welcome to the How to Survive Healthcare podcast. I'm your host, Kayla Thompson-Riviere, seasoned critical care RN turned independent patient advocate. Tune in every week so that you can learn the things about the U.S. healthcare system that no one ever tells you. That way that you can get the most from it and optimize your health outcomes. Now, of course, this podcast is strictly to inform and entertain and should never be taken as a substitute for medical advice. Let's dive right in. So picking up where we left off will be number 6, which is promoting patient-centered care. So when you or a loved one are in the hospital, typically you can get kind of wrapped up in what I call the conveyor belt of care. So a lot of times you come in the hospital and you have a specific disease process going on. Let's say you have pneumonia. Well, there's going to be a treatment protocol for that, a whole slew of things that get ordered. That in of itself is not necessarily a bad thing. These protocols are in place because healthcare is run by people. People are prone to errors. So by having these protocols, it helps to make sure that your healthcare team is not forgetting crucial elements to your care plan by having to recreate the same thing over for every patient. However, what that means is, a protocol, while it's great, it's not going to be tailor-made to that patient. There's oftentimes going to be things that either are on the protocol or are not on the protocol that are going to be important for you. And if your healthcare team is not focused on really looking at the patient as a whole, holistically, and are just kind of zeroing in on that specific disease process, some of the things that you need may be missing. And some of the things that are part of the protocol, may not be really applicable to you at all. Of course, with every intervention in healthcare, there's risks and benefits that we have to weigh out. So if there's things that are being done for you that really aren't applicable to your situation, then perhaps you're not going to be receiving any benefits, but you are receiving the risks. So focusing on patient-centered care is very important. I want to pause here and just remind you that the patient is ultimately the one who is in charge of the healthcare that they receive. I know I've said this before, and of course that doesn't mean that you can just waltz into a hospital and demand treatment that you want. But what it does mean is that when a treatment plan is put in place, it is not something that you are obliged to receive every part of. If something doesn't feel right for you, it is absolutely within your right to pause, ask more questions, get a good understanding of that element of the treatment plan, and then ultimately you have the right to say, no, I don't think this is a good fit for me. A piece of information or a tool that you can use to help with the decision making is the acronym BRAIN. Whenever you're doing medical decision making, I really encourage you to use your brain. So BRAIN stands for benefits. You want to understand the benefits of what is being presented to you. Risks, understanding the risks of what is being presented to you. Any alternatives? If you don't go through with this piece of the treatment plan, what are some alternatives that we can look at instead? I being interventions, or increased monitoring. Again, that kind of goes hand in hand with the alternatives. And N, nothing. What happens if we do nothing, even if it's for a short period of time, and perhaps reevaluate that piece of the treatment protocol. So whenever you're given pieces of information that, perhaps your instinct is, oh, I don't really feel like that might be right for me, I encourage you to pause, use that brain format, and see if this is truly part of your care that is centered around you as a patient. So the next piece, tip number 7 for how to survive the hospital, find support. Now, this can be for both the patient and the family members. Being in the hospital is obviously a very stressful time. And this group that we're in right here, How to Survive the Hospital, is a fantastic place for finding that support. If you are in the hospital, please post and reach out. If you're just as a venting place, or you want to try to find somebody who's maybe been in a similar situation, so you can chat and get that camaraderie. You could also find, excuse me, oftentimes you can also find good support in disease-specific support groups. So perhaps you're in the hospital because you've been having challenges with your diabetes. A diabetes support group may be very, very helpful for you. There's all kinds of support groups locally. You have to look within your area. Often asking the hospital staff or the social worker is a good place to start. But then there's a plethora of them online. You can find a group for anything on Facebook. That's a great place to start. In the event that you need more than just emotional support, perhaps you're having difficulty with your hospitalization. You're having trouble communicating with your healthcare team. You feel like a lot of things are happening to you as opposed to for you or with you. That may be time to consider reaching out to independent patient advocacy group. Here at Heard for Life, I actually specialize in guiding the person who is having an acute crisis, meaning they are in the hospital and having difficulty. So certainly always feel free to reach out to me. Now, of course, independent patient advocacy does come with a price tag, and a lot of times that can be a strain. The Patient Advocate Foundation is a free nationwide resource. Now, they don't work one-on-one with patients individually, but they can oftentimes help get you pointed in the right direction for whatever struggle that you're having. On that note, let's talk about some finances. If you are somebody who is having difficulty affording your food or medication even before you land in the hospital, when you're in the hospital, it's a great time to get plugged in with the case manager or social worker. They should round on you and stop by anyways, but if they don't, just ask your nurse about that. But they can get you plugged in with resources for food. Oftentimes, especially if you put on a new medication when you leave the hospital, they can get you a 1-month supply to get started with. Sometimes at the facility I work at, we can actually send people home with food boxes and help get them plugged into programs. If you don't have insurance, they can help you get through the whole process of qualifying for state Medicaid or other insurance. There's a lot that the social workers can do. So this is a fantastic time. Again, they're right there. They can come right to the hospital room and talk to you to get those resources plugged in. Additionally, it's not quite when you're in the hospital, but eventually once you get home, you will get that hospital bill. And you would be surprised the number of errors on hospital bills. So the first thing is just make sure you don't pay it right away. Ask for an itemized copy of the bill from the hospital. And it's very tedious, but you're going to want to go through it line by line and make sure that the things that you're being charged for were actually applicable to you. A lot of times what happens is once you request the itemized bill, the final bill actually goes down because when they itemize it, they'll find duplicates. So just in itemizing it, a lot of times the bill that you're responsible for does go down. In addition to that, nonprofit hospitals are required to provide charity care. However, charity care can be very difficult to obtain, as you can imagine. A lot of times, although it's something they're required to offer per federal guidelines to be considered a not-for-profit hospital, it's not something they necessarily want to just willingly give away. So charity care can be difficult to get qualified for. If you are of low income the income restrictions actually are probably higher than you may think. I don't recall them off the top of my head. But if you're having trouble, think that you may qualify for charity care and are having difficult, please reach out to Dollar4. That's DOLLARFOR.com. They're a nonprofit that actually specializes in helping people get the charity care that they receive. They're fantastic people, and they will fight like hyenas to get these things approved. If you do not qualify for charity care and looking through your medical bill is just incredibly overwhelming, which, believe me, I get it. There is actually advocates who specialize in medical billing. And the majority of the time, the amount of money that they'll save you is actually more than what you'll pay them for their services. So it works out to save you money and the stress of having to figure it out yourself. At the very least, you'll know that it was done properly and that you're being billed for the right things, and then can set up payment plans from there. Step 9, discharge planning. Now, this is where a lot of things can go awry. The moment you come into the hospital, part of the care plan is, of course, to get you better, but your care team is already looking for what is the plan to get you back out. Hospital beds are limited, and unfortunately, I understand it. A hospital is, at the end of the day, it's a business. They need to make sure they can keep their doors open. But oftentimes what this means is that hospitals are running at or above capacity at all times. This is why you'll see that in long wait times in the ER, or perhaps you come through the ER and you're admitted, but it could be hours, sometimes days before you actually go up to a hospital room. And it's because these hospitals, there's simply not enough room for all of the people. The other side of that is, once you are in there and you have a room, they are oftentimes trying to get you out as fast as possible. Now, that may sound like a good thing, because who wants to stay in the hospital for a long time? But there's a reason you're in the hospital. And so I have found there can be a lot of times where people are getting, patients are getting kind of pushed out of the hospital maybe before they're ready. So in regards to discharge planning, this is an area where you have to hugely advocate for yourself or for your loved one who is in the hospital, and make sure that there is a safe plan in place before that patient leaves. And if there's not, you got to put down your foot, talk to the doctor, the nurse, the case manager who's getting it all organized, and refuse to leave until there is a safe plan in place. If a patient is having difficulty walking, it's probably not safe for them to just go home. Maybe they need services. Maybe they need short-term rehab. Has physical therapy come to evaluate them? On the other side of that, if physical therapy comes to evaluate the patient and does recommend short-term rehab, I highly encourage you to go with that recommendation. There's a lot of people who I've come across that they've been in the hospital for so long and they just want to go home and will refuse short-term rehab. And then it turns out they're really too weak to safely be at home, and they end up falling and injuring themselves and coming back in. And that's not something that we want to see. So if rehab is recommended, please take it. If you feel like you're not going to be safe at home, please advocate to have physical therapy, occupational therapy involved, and to really get the support that you need to be safe getting out of the hospital. Again, this is an area where if you're having difficulty with this planning, it may be wise to reach out to an independent patient advocate, or again to the Patient Advocate Foundation, and see how they can help you. The last piece I want to touch on today, tip 10, is emotional well-being. As I mentioned before, being in the hospital is very stressful, both for the patient and for the family around them. Please, when you are in the hospital or your loved one is in the hospital, this is the time to call on your friends, your family, If you're religious, your church members or other religious affiliations, and really get that support. Do not be afraid to ask for help with your kids or your pets, or for someone to bring meals to the family who's spending a lot of time with the patient. There's a website called mealtrain.com, and it's very simple to set up, and you can set up to have people sign up to bring you meals. So it makes the coordination of that very simple. When your friends and family are sick and in trouble, people want to help, and oftentimes they don't know what to do. So please do not be afraid to take them up on that offer and tell them specifically how they can help you. In addition to that, of course, reaching out in those groups, like I have previously mentioned, is very helpful. And always talk about your feelings. Don't feel silly about it. When you are the patient in the hospital, you can get stir crazy very quickly. So, and a lot of times the types of things that you may typically use to de-stress or unwind may not be available to you. So if it's not already part of your practice, this is a fantastic time to start working on some deep breathing exercises, or perhaps some guided meditations. That may sound kind of silly if it's not something that you do normally, but the thing with that is that deep breathing and meditation can be done anytime, anywhere, without equipment, or no matter what your medical situation is. Ideally, if you're not in having a respiratory issue, some of the simplest deep breathing you can do is to breathe in through your nose for 4 seconds, and then slowly breathe out through your mouth for 8 seconds. And that pattern of a faster inhale and a slower exhale actually really helps to regulate your nervous system and get you calmed down. Another way to remember it, I like to say, is smell the roses and blow out the candles. There's also apps that you can download to help you with a guided meditation. So you'll just kind of listen to what they're saying. And it really is helpful to get into a place of relaxation when you're so stressed out. And again, you can't walk your dog or take a bubble bath or some of the things you may typically do. The last piece I want to say to that is, to the best of your ability while you're in the hospital, please engage in physical activity. If you are capable of getting out of bed and walking, do that. Even if you're hooked to IVs, advocate for yourself and ask for them to be put on a pole on wheels. Your nurses, that way you can at least walk around the nurses' stations. A lot of times you're not going to be able to leave the unit or go outside. Again, always ask. But just getting up and getting some blood flowing is going to help you to feel a lot better, both mentally and physically, than just laying in that hospital bed. If you're not able to get out of the bed, then do as much as you can in the bed. You can do arm exercises, squeezing washcloths, lifting your legs, rolling around. Any movement you can get in to get a little bit of blood flow, again, is going to help you feel better mentally and actually help your recovery physically. So I hope that this was helpful for you. I know this was, again, a bit of a long one. I think I'm going to try to keep them a little bit shorter moving forward, but just so much good information to cover. Please let me know what you think about this in the comments. If any of this stuck out to you, if you have additional questions, and if you have other questions that you'd like me to cover in the future, that would be great. Again, like I've said before, I'm just kind of guessing on the types of things that you may need to hear. So let me know, and I'd love to create that content for you. Thanks, guys. Have a great